before they get intubated, before they get the vent put in, they are still like, why are you wearing a mask and shit like that. It's a really sad picture that she drew on Twitter. And I talked about it yesterday, but I guess that she's on CNN now talking about it as well. So let's take a look.
The hospital is being overrun with COVID patients. They come in, they're horribly ill, they're gasping for breath, and yet they don't believe they have COVID?
Yeah, I think the hardest thing to watch is that people are still looking for something else and they want a magic answer and they don't want to believe that COVID is real. And the reason I tweeted what I did is it wasn't one particular patient, it's just a culmination of so many people. And their last dying words are, this can't be happening, it's not real. And when they should be spending time FaceTiming their families, they're filled with anger and hatred. And it just made me really sad the other night. And I just can't believe that those are going to be their last thoughts.
I mean, this is literal cult shit, okay? At the heart of it, of course, is American exceptionalism and American individualism. Cancerous ideas. Don't say fuck them, dude. These people are delusional, but ultimately, you got to try and save them. And unfortunately, we're not doing enough to try and save them. I know I make fun of them all the time and say like they're fucking hogs and shit, but like you gotta fucking sometimes reach out and try to save them as best as you can, because like this is unacceptable. This is getting to a point where this is literally getting to a point where it's unmanageable. Like I don't know why more people aren't freaked the fuck out over the fact that Donald Trump got more votes than Obama did. Like
thoughts and words.
Anger and hatred towards you?
I think it's just a belief that it's not real, and nursing happens to be on the receiving end of that. And that's okay. We can take that. That's what you're there for. It's just in the bigger picture when you try to reason with people of, can I call your family, your kids, your wife, your friend, your brother? And they say no, because I'm going to be fine. And you're watching their oxygen levels, maxed out on what we call vapotherm at 100%, and their oxygen level might be 75. That's not really that compatible with life. And we know where that's going to head. And it just makes you sad and mad and frustrated. And then you know that you're just going to come back and do it all over again. And so, yeah, that's kind of where that stemmed from.
How could it not make your own head explode? They're gasping for breath. Their oxygen levels are dropping. What do they think is wrong with them?
I think people look for anything. People want it to be influenza. They want it to be pneumonia. They want it to be, we've even had people say, well, I think maybe it might be lung cancer. Something so far-fetched. And the reality is, since day one, when COVID started in this area in March, you've kind of been able to say, if it walks like a duck and talks like a duck, it's a duck. Like, I hate to tell you that you have COVID, but that's what you have. Even after positive results come back, some people just don't believe it. Now, that's not everybody. We have a lot of patients who are very, very grateful for their care and very thankful for what you do. But unfortunately, that's not what I'm remembering right now. And as my nursing career, that's not what I want to be remembering for. I want to remember the saves and the happy situations. And what I was remembering chilling on the couch the other night with my dog was not that.
Of course not. Of course not. And it's just so mind-blowing to think that they would rather have lung cancer. They'd rather a diagnosis of lung cancer than of coronavirus. And so, you've said that it just, if I quote you from morning television, it's an effing horror movie that you live every day. And so what toll is this taking on you?
Yeah, hindsight, I didn't realize that this was going to go viral. I probably could have left the F-bomb out of there, but the reality is that's how you feel. And so it is like, it's just a movie where the credits never roll. You just do it all over again. And it's hard and sad because every hospital, every nurse, every doctor in this state is seeing the same things. These people get sick in the same way. You treat them in the same way.
My take is, I think that Mitch McConnell demonstrated to the National Republican Party that as long as you fuck over Democrats, you really won't suffer the casualties or the consequences of it. And as long as you run an obstructionist policy and you stop every fucking bill, even if it's really good for the people, you'll succeed and you won't get punished. As a matter of fact, if you concede to the Democrats and look like you're dealing with them, then you might actually see consequences for it. Now, what is happening with the Trump administration is one step further. The Trump administration, to me, at least, has shown that the Republican messaging strategy is so powerful. The Republican infrastructure is so vast and so influential and so strong that if horrible things are happening, they can literally get a significant chunk of people to refuse to see what's in front of their eyes. They can get people to literally refuse reality that is right in front of their eyes. It's like, this is something I mention all the time about flat Earth. Like, flat Earth kind of makes sense because the Earth feels flat. If you look outside, it looks fucking flat, right? A stupid person can get on board with that. It's harder to justify or it's harder to explain gravity than it is to be like, I see the Earth, it looks flat, it is flat. This here, like what we are watching, is literally the harder thing. COVID is not a real problem, is definitely a very difficult undertaking. You need a fuckload of money and a fuckload of deliberate bad faith actors to push this sort of falsehoods so consistently to make people believe believe that like what they're seeing right in front of their eyes is fake. It's really bad, dude. It's really, really, really bad. Wait, what the fuck? Minder? Apps include Muslim Pro and Muslim Mingle. The data is reportedly collected by a third party called Xmode, which then sells to the contractors. And the U.S. military is buying location data about Muslims retrieved by Muslim dating and prayer apps. What the fuck? That's some fucking freak shit, dude. What? The U.S. military is buying granular location data.
My dad is on a ventilator
of people
COVID.
harvested from ordinary smartphone apps through document sources and technical analysis. We also identify specific apps. The biggest, a Muslim prayer app with 98 million downloads. Wonder what they're going to do with this information. All right. Once this is over, you'll segue perfectly into what's going on in El Paso.
The same way, and then you do it over again. And we're so thankful for the lessons we've learned along the way, and we're doing a good job of taking care of the people that come in. And we're managing our patient loads here right now. Sometimes it's day to day, sometimes it's hour to hour. But the reality is that right now it's not getting better. You said just as you started the show, 50 to 60% positivity rate. I mean, our entire state has 880,000 people. It doesn't take much to do the math on that for how many of us are sick.
Oh my gosh. When you hear your governor, Kristi Noem, say, my people are happy. They're happy because they're free. What's your response?
I think it's frustrating as a healthcare provider because the last thing that we ask anyone when they seek care.
Nothing more freeing than the freedom to die as you're gasping for breath away from your friends and family as you deny that this virus is real and that it's somehow China and Demon Rat's fault. That's real freedom, brother. Wearing a mask to make sure that if you have it, you don't give it to the fucking cashier. That's not freedom. That's Orwellian, brother.
There is how they voted or if they're a Democrat or Republican. The last thing we ever think about is that. What we think about is, how can I help you? And so anybody that uses any chance to make this political makes any healthcare provider want to scream, because at the end of the day, we just want to help. And if we don't get some help from the public as far as mask wearing and social distancing,
like the wildest part about this is like, how we look back at like the Salem witch trials and shit and say like, wow, that's really horrible that they were just like literally, murdering women. Or or we look back at the horrific consequences of slavery, right? But there's still a fucking financial component there, like, or at least there is still an otherizing of an outside group. In this circumstance, you're literally killing yourself. Okay? In this circumstance, unlike the previous two instances that I just mentioned, you're not enacting pain and suffering on others, but literally on yourself and refusing to recognize it. Okay? Like, in a way, it's no different. In a way, it's no different than all of these horrible things that we've done in the past to outgroups. But in this circumstance, you're literally killing yourself to own the libs, I guess. And that's fucking insane to me.
There's a thing on the internet right now that says, I'm not your first line of defense, I'm your last. And that actually is true in South Dakota, that by the time you get to me and the team that we work with, it might be too late for some. And that is heartbreaking because the reality is we're a small state. The town I live in has 650 people and we have 680 deaths right now. I mean, that's my entire town wiped off the map. We know these people, we go to school with them, church, grocery store. It's every small town story you've ever heard. But just so I understand, Nurse Doring, you have more deaths than you have people in your town. Yeah, in the state of South Dakota, I haven't looked in the last few hours. I think we had 683. Don't quote me on that. But the town I live in has 650 people. So when you put in perspective, and people listen to me talk about this for the last 9 months, that's every single person in our town gone. That's pretty mind-blowing. If we had a tornado that came through and killed 20 people, we would stop and look and the national news would be there. And so the fact that we have this many deaths in a town or in a state this size is mind-blowing to me. And it's not currently getting.
DNC needs to look into cold reversal techniques.
Keep being great hassle.
I don't know if that's gonna work. No, she's saying the entire state has more deaths than the number of people in her town. Chat. That's what she was saying. I don't know why you had a hard time comprehending that. Anyway. Republicans are so quick to thank and do anything for soldiers for protecting us, but literally don't give a fuck about healthcare workers who are literally... Wait, no, they're not there to do anything for soldiers. No, the whole concept of, like, thank you for your service for soldiers is the exact same thank you for your service for the healthcare workers. You're supposed to die, and we don't give a fuck about you, and we're not going to do anything to help you, so we'll just do a fucking quick jerk-off session for you to make it seem like we give a single shit when we don't. What the fuck do the American military get? What do all those, like, what do all those middle class and fucking working poor family members that, like, join the fucking military because they want to escape their bumfuck town or, you know, the opioid epidemic or get themselves in fucking shape or be able to have a shot at upward social mobility to get a fucking college, to get a goddamn college education. What do we give them when they come back broken as fuck? Nothing. They just get PTSD, and if they're lucky or very unlucky, they get health care, okay? They get the best health care that they could possibly get. But that comes at a cost. They get an opportunity to fucking get a communications degree and then participate in the fucking labor force, the labor market that we're all beholden to that absolutely sucks ass. But now on top of that, they also have fucking PTSD and lose their shit while trying to figure out which fucking cereal they want to buy at Walmart. Or lose their minds when fucking 4th of July fireworks are also being fired to celebrate those same soldiers. It's fucking bullshit. What's the number? It's like every 22 minutes a veteran commits suicide in this country. Sağ üstteki subscriber rakamıdır kardeş. Şu anda Twitch'teki en çok subscriber olan adam Türk. Ben. Or no, is it 20 every? Is 22 kill themselves a day? Anyway, not every VA medical center is bad. Sure, ones like Orlando is way understaffed, over veteran populated. Mal inanmadı. Hadi lan oradan diyor. Anyway, as I was saying, is it, oh, it's 22 flex'e gerek vardı şimdi. Sordu oğlum, cevap vermeyeyim mi? Yalan mı söyleyeyim? Anyway, so that's why we fucking treat nurses and frontline workers right now, and like people that work in essential businesses right now in the exact same way. We're not going to give them PPE. We're not going to give them fucking hazard pay. We're not going to give them the overtime that they need. They're just going to need to suck it the fuck up and die, okay? And you're not going to get anything, but I don't know, we'll hit some fucking pots and pans at 8 p.m. We'll get the people to hit pots and pans every 8 p.m. every night in unison, okay? And this is horrifying. Like, the long-term consequences of how much pressure we are subjecting our fucking nurses and our EMTs and all the people that work in hospitals and our doctors is fucking insane. I do not know what the fuck is going to happen to all of these people if at some point we finally get over the hump.
Keep talking the talk, brother.
So it's just thoughts and fucking prayers, baby. Thoughts and fucking prayers, so that motherfuckers can go get their jalapeno burgers at Applebee's with their fucking friends and drink their piss beer and feel a sense of normalcy and not want to wear a fucking mask while they're doing that. I live in Iowa and they're talking about our healthcare system collapsing if this keeps up. My grandma just died last Thursday. My grandpa just got admitted to the hospital this morning and he's 84. Yeah. No, Trump's not going to have the fucking military on his side. That stuff is behind us, okay? Let's look forward. That shit doesn't matter. Fuck Donald Trump. Anyway, moving on.